Benji Cole, son of Al Cole from CBS Radio and host of People of Distinction, the talk that gives an in-depth view of some of the most dynamic, intelligent, and successful people on the planet. Run to our website, peopleofdistinction.org for more info, or you can always email me directly at benji@alcoleenterprises.com. And on the line with us today, we have Dr. Patrick Ojo. We'll be discussing his fantastic book, Pharmacy in Bondage, 2nd edition. Available for purchase through Amazon, barnesandnoble.com. But if you guys want to get everything that Dr. Ojo has to offer, do yourself a favor and go directly to his personal site, liberatepharmacy.com. There, not only will you find more information on Dr. Ojo himself, you'll find more information on this book, Pharmacy in Bondage, as well as find hyperlinks set up to take you to the purchasing page. So one more time, that's liberatepharmacy.com. And I will say, Dr. Ojo was brought to our network, People of Distinction, today by some of the best movers in the business. UR-Link Print and Media Publishing. So if you have a book that you'd like moved, do yourself a favor and contact UR-Link. You can find out more information on them at urlinkpublishing.com. So without further ado, let's jump right in. Dr. Ojo, first and foremost, welcome to People of Distinction, and thank you so much for being a guest. How are you?
I'm fine. Thank you very much.
Absolutely. Well, listen, we're very much looking forward to this and really looking forward to the knowledge and the wisdom that we're going to be able to receive from you. Now, Dr. Ojo, I know we have so much to cover, but before we go into the book, let's hold off slightly. Start by telling our listening audience a little bit more about your background and some of your accolades.
Well, I am Dr. Patrick Ojo, the author of Pharmacy in Bondage. I'm the clinical pharmacist, work in various pharmacy settings, including hospital, in the also community, prison, and everywhere. I've worked in various settings of pharmacy. So that is my background. And this book entails a lot of research, worldwide research that is contained in the book.
Fantastic. Dr. Ojo, without further ado, Pharmacy in Bondage, 2nd edition. Tell us a little bit more about your book.
Yes, this is a book that excavates the basic truth in medicine, and that pharmacy is being overeducated, marginalized, underutilized professions. As a matter of fact, what I would like to let people know is that we have specialty taking care of every sphere of our life today. The only place we don't have specialty is in the poison that we pump into our body as drugs. And the pharmacists are the ones that are treated like children in their supposed area of jurisdiction. Research upon research, studies upon studies have shown that, in the book, have shown that these are more revealing of the fact that if pharmacists are allowed to do what they do best, they do a whole better job than other branches of medicine put together. So I have researched that compared drugs that are taken in various schools of pharmacy and the various other branches of medicine. And this reveals that it will interest you to know that the physician assistants, only 1 out of 14 courses qualify them to prescribe drugs. The certified nurse practitioners, 1 out of 25 courses qualify them to prescribe drugs. The veterinarian, 1 out of 11 courses qualify them to prescribe drugs. The optometrist, 1 out of 17 courses qualify them to prescribe drugs. The dentist, 1 out of 33 courses qualify them to prescribe drugs. And other branches of medicine, 1 out of 17 courses qualify them to prescribe drugs. And guess what? 7 out of 10 courses do not qualify the clinical pharmacist to prescribe drugs. As a matter of fact, if the clinical pharmacist dare prescribe from the physician assistant formulary, they run the risk of losing their license or going to jail. That is where we are coming from. And to let the world know that this is an unjust act. And every time the pharmacists put their knowledge into use, They saved human lives, saved a whole lot of money for the healthcare system. And what else are we looking for? So if we just think that, okay, these people know what they are supposed to know and they are supposed to put their knowledge into use, why are we keeping them the way we are keeping them? And it doesn't make sense. An engineer go to school for 4 years is in charge of his own destiny. The journalists go to school for 4 years is the same thing. Historians, all of that, 4 years. 6 to 8 years of school in pharmacy do not qualify the clinical pharmacists to be in charge of their own profession or be in charge of their own destiny. These are the things we are talking about. Recently, or let me say in 1996, Dr. Katiwari is a pharmacist or clinical pharmacist. She was a nurse before she became a clinical pharmacist. What happened was that she was she's a professor in Certified Nurse Practitioner School, as well as also work in Mayo Medical Center, Rochester, Minnesota. She was one of 12-member committee or panel that was set up to look into what qualifies the certified nurse practitioner to prescribe drugs to patients. And then she herself questioned everything, that she is a professor of pharmacology, and this is the task that the panel was asked to look into: the pharmacological background that qualified the certified nurse practitioner to prescribe drugs. And she said she has 1 hour to teach hyperlipidemia, hypertension, diabetes, and anticoagulation. 1 hour, just 1 hour. And these are people that are practicing in various settings in the whole nation, under the notion of supervision. And we all know that they all practice independently. Drugs are being pumped into people and like candy bars. They are thrown into patients like candy bars. And the end result is that people are dying from drugs. We have statistics relating to this. The World Health Organization studied drug-related morbidity and mortality in U.S. in 1990, and they discovered that drug-related morbidity and mortality cost U.S. 1.6 million hospitalizations and 160,000 deaths. In 1992, Think studies showed that the drug-related morbidity and mortality cost us in U.S. 198,000 deaths and $76.5 billion. In 1994, Lazarus studies showed that 106,000 deaths result from hospital alone. Just hospital alone, 106,000 deaths. And that was when they were able to put drug-related morbidity and mortality as 4 to 6 leading cause of death. 4 to 6 leading cause of death. And when we allow clinical pharmacists to do what they do best, they reduce all these problems. They reduce all these problems to the barest minimum. So why are we keeping them in bondage? This is what the book is about. If you look right inside the book, you will also see that there are what is called Thompson studies. The Thompson studies show that the prescriptions written by clinical pharmacists are better than others in the medical field. And then you have the Zagogian studies. In Zagogian studies, if I have to go into all these studies, there is not enough time for me to do that. But to talk about the goodness of pharmacy. In 1994, there was nursing home regulation modification. And as a result of that modification, the clinical pharmacists were given the power to intervene in medication management in nursing home. And what was the result of this? They discovered that 8,500 human lives every year is saved by the clinical pharmacists. 8,500 human lives is saved every year by the clinical pharmacists. And they saved $3.6 billion for the healthcare system. $3.6 billion every year for the healthcare system. The bond studies shows that every time the healthcare system and the government or anybody or insurance spends for the $320 on the clinical pharmacy salary, they save one human life. They save one human life. And anytime they spend $1 on the clinical pharmacy salary, they save $244 for the healthcare system. Not only that, they discovered that when the clinical pharmacies are put into use in the hospital and other places, they cut the patient's length of stay in the hospital by 4.78, almost 5 days. They reduced the numbers of days that the patient stays in the hospital from what it was supposed to be by about 5 days. And these are all savings for the healthcare system. What is all this pointing to? That these are the specialists in this area we are not allowing to do what they do best or what they are trained to do. And yet all other people are controlling them the way they go about their business in medical field. Recently, I was in a place where a dentist was using the height of one model fits all. I saw prescription upon prescription from this dentist. Same dentist, different patients for amoxicillin and ibuprofen, 800 milligrams. And this ibuprofen, 800 milligrams, was given to these patients 4 times a day. 4 times a day. What does the dentist know about this medication creating problems for the stomach of these patients? Or that these patients might be taking some other NSAID drugs in the society that is not known to them. But if the clinical pharmacists or the pharmacists dare argue about this kind of therapy with these dentists, all he's going to hear is that, oh, you are to dispense. I have written my prescription and I've done my work to prescribe the drugs. Yours is just to dispense. That's it. And you can no longer argue beyond that. And guess what? It's just 1 out of 33 courses that qualify the dentist to do this. 7 out of 10 courses do not qualify the clinical pharmacist to do what they are supposed to do best in their own area of specialization. And the Father Paracelsus said this right, that all are poison. All are poison. The only thing that made the difference is dosage. So if I can go on and on and on, but I don't want to overrun everything because I want to give room for the moderator to be able to ask questions and to find out what he wants me to talk about specifically so that I can address them. So, moderator, please, I hope I have not overused some of the times that I was supposed to. Mr. Cole, can you go ahead and ask any question that you want to ask?
Yes, absolutely. You know, Dr. Ojo, thank you so much for everything that you've relayed so far. Guys, I told you when we first started this interview was going to be jam-packed with knowledge and education. And that's exactly what we're already witnessing, what we're already discussing, and it only goes further when you pick up the book. So one more time, Amazon, Barnes & Noble are the places you have to go. Pharmacy and Bondage, 2nd edition, is the title you have to pick up. And Dr. Patrick Ojo is the author you have to thank for bringing it to your table. But remember, check out his personal website, liberatePharmacy.com, to gather everything that he has in store. You know, Dr. Ojo, next question that I'd love to go into, talk to our listening audience a little bit more about the research that you did in preparation for the book. Clearly, your background is in pharmacy, so a lot of this will be coming from your own individual experience, but I'm sure there was research that was conducted as well in helping you comprise this narrative. Talk to us a little bit more about that, please.
Okay. Thank you for that question. Actually, it was when I was in Long Island University, the School of Pharmacy. I was studying for one of pharmaceutical chemistry, and that was a course most of us dreaded as a student. And I was on my way to the library, and all of a sudden something dawned on me that, wait a minute, if I have to end up as a dispenser, why do I have to learn all this? It was a big question for me. And then I said, wow, something is wrong here. If after learning all these things, we are not given the opportunity to impart the patient what we learn in school, it means something is wrong. The electrician, the electrical engineer, they only spend 4 years in school. All other branches of that you can think of, many, they spend 4 years. Even the dentist, as now, optometrists, they spend almost the same year in school as the pharmacists. So why should the pharmacists graduate from school and be made redundant, overutilized, or overeducated, underutilized, and marginalized professionals? So that was when that was where I got this motivation to really go into this and make all this research. So as I began to make the research, the whole world began to reveal itself to me. And I conducted this research not only just in USA alone, in Africa, in Asia, in Europe, and then in all the 6 habitable continents of the world. I conducted this research. And I compared all the courses, most of the courses, especially in USA, the courses between what was offered in the School of Pharmacy and what was offered by the various branches of medicine. And I discovered all these discrepancies. So that is why we now have the drug-related morbidity and mortality as the 4 to 6 leading cause of death. So when we allow pharmacists to do what they are trained to do best, we can reduce this problem from 4 to 6 leading cause of death to 30, to 20, to 40. The specialists are in control of every sphere of our life today. So why are the pharmacists being treated differently in the medical field, or in a bid to satisfy all other branches of medicine? And guess what? Anesthetics. Anesthetic is a branch of medicine. And anesthetic is an intestinal part of pharmacy. I consider anesthetic as pharmacy baby. Yet it's a branch of medicine. How did they become a branch of medicine? Is it because, people just feel like, we should give them their own discipline, their own specialty? No. It was the surgeon that demanded for this branch of medicine. And why did the surgeons demand for this branch of? They did not just maybe go to bed one day because they overfed themselves, and then the next morning they say, we are going to just wake up and give freedom to anesthetic, or maybe out of the goodness of their heart. It was because when they were trying to combine anesthetic and surgery together, there were a lot of human deaths in their hands. It was a big catastrophe for them. And that was why they had to separate anesthetic from what they were doing, the surgeons. And if that could happen at that time, that was in 1937. It takes 6 months for anesthetic to be defined as a specialty in 1937. And guess what? Pharmacy was originally given birth to or conceived in Baghdad, Mesopotamia in the 9th century, about 12 centuries ago. And pharmacy was the first branch of medicine to be conceived. Up to tomorrow is yet to be liberated. It's yet to do what they are supposed to do for the benefit of mankind. So the anesthetic became an independent branch of medicine because the surgeons wanted it. And nobody wanted the same thing for the father or the parents of anesthetics. So something is wrong here. Something must be wrong here. How can you have a baby, somebody say, it's okay for that baby to be liberated. It's okay for that baby to be independent. And then they say the parents need to be in slavery. The parents need to be in bondage. Something is wrong there. And when you look at the whole statistics, when the clinical pharmacists put their knowledge into use, they do a whole lot better job than all other branches of medicine in terms of prescribing drugs. Look at the PA, the physician assistants, only 1 in 14. And 75 nurse practitioners, 1 in 25 courses, 1 in 25. So how much do they know about the drug they are just pumping into patients? When you just go to and then they pump all these drugs into you, and then you take them, and then you go home, and then you start having complications. You don't know where the complications are coming from. All these are all poisons. And if we have specialty taking care of all other branches of our life or all other aspects of our life, it makes sense that we allow pharmacists to do what they are trained to do best. 6 to 8 years of course, 6 to 8 years of studentship. If they all other branches, they spend almost the same thing. They are veterinarian. They spend the same time. The dentist, the optometrist. So what is going on? Something must be wrong here. We need to liberate pharmacy for the benefit of mankind and save many human lives from unnecessary deaths. That is what was the motivation for this book.
We've discussed so much already, but is there anything else that we haven't yet touched up on that you really want to make sure our listening audience is aware of?
Well, what I want to make sure that the listening audience are aware of is that they need to be cautious of the fact that pharmacists are overeducated, underutilized, and marginalized medical professionals. They need to be liberated for the benefit of mankind. I cannot overemphasize that issue. If they have any doubt about anything, get a copy of the book, read for yourself. This is not just a question of maybe me saying it. The governor of Kansas State, the former governor of Kansas State, and former Health and Human Services Secretary, Kathleen Sebelius, read the book, and said this was a big force. And you saw in the book, in the second edition, the acknowledgement from the governor. Not only her, there are other people too. The Hollywood Book Review did the same thing. There are thousands of people that have gone through the book and said, this is awesome, marvelous. There's no way anybody can describe this other than something really good. So, Kathleen Sebelius, and then these other things, the Federal Pharmacy Association, the New York State Pharmacy Association, then there are the California State Pharmacy Association, a whole lot of people that have gone through the book and say that it was a real big positive force moving the pharmacy forward in the right direction. And what is even more, I don't know if you are familiar with what is called University of California, San Francisco.
Mm-hmm.
That is number one school of pharmacy in the whole world. It's number one school of pharmacy. They initiated the Doctor of Pharmacy degree program, and they initiated the clinical pharmacy practice program. So these people, this school, as a matter of fact, they have acknowledged this book as a big force. That everything in the book is just the truth. It's just the truth. So what else do we want? All we need, and do you even want to know that in 2008, because when this book was written, it was sent to all senators, it was sent to the president, it was sent to the vice president, it was sent to the House of Representatives, all of them. And do you know Representative Hector Wilson from New Mexico tendered a bill in the House of Assembly for Medicare Clinical Pharmacy Prescriptive Act in 2008. And the only reason why that bill did not see the light of the day was that there was not enough agitation from the public, not enough ovation or people talking about it, or maybe the public awareness was not there. And that is why we are trying to do all this now, to bring attention to what is going on so that pharmacy can be liberated for the benefit of mankind. If that bill had passed through the Senate and passed through the House of Representatives and then signed into law, by now everything would have been history. And pharmacists would have been saving a whole lot of human lives everywhere. Remember I told you before, in nursing home alone, every year the clinical pharmacists save 8,500 human lives. 8,500 human lives. And they save $3.6 billion for the healthcare system every year in nursing home alone. So what are we looking for? And when we are talking about all these savings, it's against the tradition or what is currently going on in practice. So they are exhibiting a better knowledge and greater knowledge and saving more human life and saving more money for the whole system. So what is the problem? What is the problem? Why is it that we cannot try to grapple with this issue? It's beyond anybody. So this is where we are at now.
Sit back, get ready for the education. I mean, Dr. Ojo just took us to school. Okay, fantastic stuff. This is something that is absolutely fascinating to me. And from another side of the perspective that we don't often hear from. We know a lot about the pharmaceutical industry. As I stated when we first started, they're under a lot of scrutiny in recent years because of the opioid pandemic. But to have Dr. Ojo here and articulate things from a medical perspective, I think really offers a wonderful balance. And you know what's even better? We've barely scratched the surface. There is so much information left to be discovered within the book. So you know what you have to do. I'm going to say it one more time, even though I know I don't have to. Amazon, BarnesandNoble.com, LiberatePharmacy.com are the places you have to go. Pharmacy in Bondage, 2nd edition is the title you have to pick up. And Dr. Patrick Ojo is the author that brought it to your table. Let's grow, let's develop, let's educate ourselves, and it starts with this fantastic narrative. Dr. Ojo, this has been such an honor, truly a pleasure. Thank you once again for being a guest with us today on People of Distinction.
Thank you very much. You are welcome. And I appreciate everything. And we rely on you people and to make us proud. And it may help us make the necessary noise that will get everybody's attention and make the elected officials to do what is right for this issue.